Good morning to one and all. On the occasion of World Mental Health Day, I, Ms. Nikita Anuporde, would be dealing with the management of psychiatric emergencies in this lecture. So, you have already studied about the management of about the psychiatric emergencies that is taken by Satish sir. We will move on with the management of psychiatric emergencies. So, psychiatric emergencies such as acute psychomotor agitation or suicidality often arise in non psychiatric settings such as general hospitals, emergency services, or doctor's office. So, it can be these emergencies can happen anywhere. So, it gives a stress to all persons that are involved. These may be life threatening and therefore be treated at once. So, we will discuss with the treatment options for the main types of psychiatric emergencies as an aid for their rapid and effective management. Now, what is psychiatric emergency? As we have we will just revise. It is a condition wherein the patient has disturbances of thought, affect, and psychomotor activity that leads to threat in his existence. Okay, so the major focus of intervention or the management is to safeguard the life of the patient, to bring down the anxiety of family members, and to enhance the emotional security to others in the environment. Now, as we have seen what are the common psychiatric emergencies, we will deal with that one by one. Okay, so for each and every psychiatric emergency, we will deal with the management differently. Okay, so here are some emergencies: violent, aggressive behavior through suicidal threat, panic attacks, stupor, hysterical attacks, transient situations, disturbances. Then we can see about the organic psychiatric emergencies. Those are delirium tremors, epileptic furor, acute drug induced extrapyramidal symptoms, and drug toxicity. Now, first we will move on with the suicide or suicidal threat. Okay, so as you all know, so these are the signs that we need to assess for the patient who has a tendency to suicide. Okay, so the management for this includes: be aware of the suicidal signs. Next is monitor the patient's safety needs, encourage verbal communication of suicidal ideas, enhance the self-esteem of the patient. Firstly, we need to have a good interpersonal communication between the patient and the nurse. For this, you have to encourage the patient to talk to you effectively. So that will give an idea of what are the suicidal signs and how you will manage those. Next, we have to monitor the patient's safety needs. You have to remove all the threats, all the toxic agents that are in the person's environment or nearby to him. We have to keep it aside. And you do not have to leave the drug tray within the reach of the patient, and you have to make sure that the daily medication that is given to the patient is swallowed by him in front of you. Then you have to remove all the sharp instruments such as razor blades, knives, glass bottles from his environment. Next is you have to remove all the straps and clothing such as belts, neckties, and those which are used, the clothing that are used as the suicidal threat. Okay, so do not allow the patient to bolt his door on inside, and make sure that somebody accompanies him to the bathroom as well. So as you are vigilant enough about all these activities, the patient will have lower down the risk of suicidal attempts. Okay, next is you should have a constant observation with the patient, and the patient should never be kept alone. You have a good vigilance, especially during the morning hours. Next, spend time with him, talk to him, and allow him to ventilate his or her feelings. Okay, so you have to develop that good communication skill with the patient and help him to talk as much as he can and ventilate his feelings. Encourage him to talk about the suicidal plans. If suicidal tendencies are very severe, then sedation should be given as prescribed by the doctor. Next, we will encourage verbal communication for suicidal ideas as well as his or fear of depressive thoughts. There can be depressive thoughts for the patient, thoughts that will urge him to have the thought of committing a suicide. But you have to have a good verbal communication with him, and thus his fears will be suppressed. Then, next is you have to enhance the self esteem of the patient by focusing on his strengths rather than weakness. Whatever the person is having his strengths, the major focus should be given on that and not on his weakness. His positive qualities should be emphasized with realistic praise and appreciation. Whatever the positive signs the patient is facing or is having, or whatever his strengths are, that needs to be recognized by a nurse, and that needs to be given an appreciation so that a patient will develop a positive attitude towards himself, and the thoughts of suppression or the thoughts of suicide will be suppressed equally. Next, you have to foster a sense of self-worth and enable him to take control over the life situation. Okay, so you have to develop the self-positivity within the patient so that he will develop a sense of self-worth, and that will help him to control the situation in which he is undergoing. Next, we'll move on to the violent behavior, that is the second psychiatric emergency that we will be dealing with. Now, this violent behavior is a severe form of aggression. Patient will be irrational, uncooperative, delusional, and assaultive. Okay, so this is a psychiatric emergency which needs utmost care. Okay, here, because of the various psychiatric condition or various diagnosis, the patient will have the violent behaviors in which the patient will not have control over himself. For this, the management of this includes you have to talk to the patient and see if he responds. Firm and a kind approach by a nurse is essential. Now, this is usually sedation is given for this, and sedation is given, that is common drugs are used, which are diazepam 10-20 mg, IV haloperidol is given, chlorpromazine, that is 50 to 100 mg, you can give it IM. So this includes the medical management of violent behavior. But once the patient is sedated, you have to take a careful history from the relatives. You have to rule out the possibility of organic pathology. In particular, check for the history of convulsions, fever, recent intake of alcohol, fluctuations of any of those medication. Next, we will move on. You have to carry out a complete physical examination. Send blood specimens for hemoglobin, total cell count. Look for evidences of dehydration or malnutrition. If there is severe dehydration, glucose saline or dextrose therapy should be administered to the patient. Have less furniture in the room and remove all the sharp instruments, that is rope, glass items, ties, strings, matchboxes, everything from the patient's vicinity or within the reach of the patient. You have to keep the environmental stimuli such as lighting, noise levels to a minimum, assign a single room, and limit the interaction with others. Then, you have to stay calm with the patient as hyperactivity may increase or reduce the anxiety level and foster a feeling of security. Redirect violent behavior with physical outlets such as exercise, outdoor activities. You have to encourage patient to talk out his aggressive feelings rather than acting them out. Talking helps to reduce the stress of a patient, and he can have a control over his ability. Okay, if the patient is not calm by talking down and refuses medications, then restraints may become necessary. Next, you have to follow application of restraint that is when you have to observe the patient every 15 minutes to ensure that the nutritional and elimination needs are met. Okay, so you have to also see for any side effects of restraint that may cause tingling or cyanosis in the extremities. Next, we have to Next, be sure that the patient has no weapons or his or possession before approaching him. If patient is having a weapon, ask him to keep it on the table and not on the floor rather than fighting him to take it away. So keep something like a pillow, mattress, blanket wrapped around his arms between you and the weapon. Okay, distract the patient momentarily to remove the weapon, throwing water in the patient's face or yelling, etc. Give prescribed antipsychotics to the patient. Okay, next is we will move to the panic attacks. Now, as we all know that panic attacks are the episodes of acute anxiety caused due to some part of or psychotic or neurotic experiences. Okay, so for tips of anxiety to lower down it, we need to practice breathing exercise. You have to instruct the patient to carry on the breathing exercise, take care of their sleeping routine, stay active, focus only on the present, that is, be mindful, then take some rest, find a creative activity. It's okay to ask for help and drink cold water. So all these tips are there to reduce the anxiety of the patient. Okay, next we will move on to the catatonic stupor. Here the main symptoms are mutism, negativism, stupor, and echopraxia or echolalia. For this, the management includes you have to ensure the patient airway, administer IV fluids for the patient, you have to collect a detailed history and perform physical examination. You have to draw any blood for investigation as prescribed for the doctor. Other care is same as for that an unconscious patient. Next, we will move on to the hysterical attacks. Now, hysteria may be a mimic abnormality or the function which is under control voluntary movement. The management for this can include you have to, as a nurse, you have to distinguish a genuine fit and a hysterical one. Okay. As hysterical symptoms can cause a panic among the relatives, you have to explain the relatives the psychological natures of the symptoms, and you have to reassure that no harm is done to your patient. Help the patient realize the meaning of the symptoms and help him find an acute way. Next, we'll move on to the transient situational disturbances that are characterized by disturbed feelings and behavior due to an external stimuli. Okay, so for the management for this is reassurance to the patient, mild sedation that needs to be given sometimes as prescribed by the doctors, promoting ventilation of the feelings and counseling. Next is the delirium tremens. Okay, so this is a condition resulting from the withdrawal of alcohol. It is the management is keep the patient in quiet and safe environment. Sedation can be given to the patient as prescribed. Then fluid and electrolyte balance is very important. That will help to suppress or normalize the patient and reassure the patient and family. Next is acute drug induced EPS. Okay, so that is extrapyramidal syndrome. So because of antipsychotics, there is a various of side effects that are caused, and these are collectively known as extrapyramidal symptoms. Okay, so management for this is stop the causative drug that is used for the patient. If you see any symptoms, then cool the patient's body temperature, maintain a proper fluid and electrolyte balance, and diazepam as a muscle relaxation can be given. Dantrolene to treat malignant hyperthermia. Any other medications can be given to the patient. Next is we'll move on to the drug toxicity. It can be accidental or sometimes suicidal. Okay, so it can include drowsiness or a vomiting sensation and something. So the management for this is administration of oxygen. You have to start an IV line. You have to assess the cardiac arrhythmias, refer to hemodialysis if needed, and administer the anticonvulsants. Okay, so just want to conclude with the management of psychiatric emergency that there is a hope even when your brain tells you there isn't. So help your patients to come out of this psychiatric emergencies and help them to manage the symptoms according to it. Thank you.